too often we as a community overlook the power, the influence, and necessity of a good health system, good hospitals, good doctors, good community programs, good conscientiousness, good information. And really, I think every facet of our society can be improved if we had a greater consciousness, if you please, of, the medical community, medicines, how important it is and the role that it plays in our lives. So I'm just more than a little happy today to have two individuals who are going to talk about, first of all, the general role of medicine and hospitals in the community, particularly the Navison Center. And then we're going to kind of tie in with diabetes, and I'm sure all of us are familiar with diabetes and, the effect that it has on us and our society. This is a call to action.
A call to action.
I'm your host, Alex Havisham. Y'all forgot it. That's all right. I'm more than a little happy today to have Mr. Reg Gilbreath and Miss Julie Deese from Navison Health, and who have two distinct roles, but they all tie in. Dr. Gilbreath just informed me that he used to be, well, tell us about yourself.
Well, I'm originally from Florida, and my folks are from the Southeast, and was fortunate enough to go to medical school many years ago, and became an internal medicine doc. And in subsequent years, I got some business training and was fortunate enough to become a physician administrator. And that's what I do now at Navison Health, Chief System of Care Integration Officer.
Okay, we'll let you elucidate on that in just a minute, but how about you, Ms. Deese?
I have worked at Navison for, we'll just say, quite a long time. I've been in diabetes education for about 22 years at Navison now. Working currently as a nurse manager there and a certified diabetes educator.
Outstanding. Dr. Gilbreath, talk a little bit about the role that medical institutions play in our society, how it affects every element of what's going on in our community.
Well, one of our major strategic goals is healthy communities, to improve the health of our community. And that has many effects, as you know. It helps employers have a healthy workplace, for one thing, okay? It keeps people with a happy position in their life, so they're not disabled or dependent on medical conditions. And so the new focus in America, I think, really is on access to care early in the process,
right,
and preventing diabetes and other conditions. And then if a person develops diabetes, actually treating that condition way upstream early in the process so they really don't develop the tragic consequences. For example, heart attacks, strokes, and renal failure, kidney failure, things of that nature. So there's a new focus in American healthcare in moving resources up front in the process to prevent the very costly and tragic downstream consequences.
Well, I'm sure you have a very, very interesting role in dealing with diabetes, and I know sometimes you are greatly saddened by behavior on the part of the community and individuals that will contribute to diabetes. Talk about some of those signs and some of those behaviors that may affect or result in getting diabetes.
Well, I think even as so many breakthroughs have come with diabetes in the last few years, behavior change is one of those things that is the hardest. So if people, we ask if they present with just increasing fatigue, going to the bathroom more, weight loss without trying to lose weight, some blurred vision, increased thirst, those kind of symptoms, to please seek medical attention and try to get that followed up, especially as they get older and have family history of diabetes, because those chances do increase each year with that.
Okay, so those are some of the signs. So what about the preventive measures? And I think that we need to really look at it seriously, because I know some people who have had amputations and, who have had other problems as it relates to what you just mentioned, Doctor. So what are some of the things that we can do? And then the other thing that we want to talk about, excuse me for cutting you off.
Oh, you're fine.
Is childhood, diabetes in children.
Mm-hmm.
I think that's on the increase. But what can we and individuals as a community do to try to help prevent, diabetes? Is it preventable?
It can be preventable. A lot of type 2, as we get older, does have to do with environmental or behavioral aspects. So there's really no secret. It goes back to just
type 2.
Type 2. Mm-hmm. As the children are generally type 1, which means that their body has just stopped producing the insulin. So they are, and that's not really something that is caused from family history or anything like that. So they stay on insulin and adjust their food and the insulin because their bodies aren't able to make it anymore. As we get older, a lot of behavioral changes, such as not exercising, gaining weight, eating the wrong types of foods, stress, things like that, increase our chances of getting type 2, which means our bodies still are able to produce some insulin, but usually not enough to do the job completely. So there are a lot of different medications for that these days. But there's no secret to really anything that you can do but a healthy lifestyle. It goes back to the basics: healthy eating, portion control, and exercise are the best things you can do for prevention and staying at a good, reasonable weight for ourselves.
Oh, that's outstanding. And I'm glad you know what? I never knew the difference between type 1 and type 2. I've seen it and heard it all of my life. So to try to make it a little simpler, type 1 is more or less, I know they are both biological, but type 1 is more biological than type 2 because it seems that it's like from the inside.
Well, they're not sure exactly still what causes that trigger, but they think it's more viral or autoimmune type that attacks the pancreas, which makes our insulin, which causes the pancreas to not work anymore.
So people who have type 1 are the ones who have to have insulin?
Correct.
Oh, okay. So, but the thing that we want to do is to try to stay away from it to the extent possible. Dr. Gilbreath, so what are some of the activities? What does your job entail?
Well, the system of care includes the community part of care before the hospital. Then you have acute care in the hospital. And then the system of care also includes the recovery phase. Sometimes we refer to that as post-acute or after acute care, but things like home health, rehabilitation. So that's the system of care.
I'm glad you explained that. So it embraces the whole situation as it relates to care.
Exactly.
That's why they call it system.
Exactly. And so I focus on quality, safety, and health equity across the system of care and as it relates to technology or informatics. Because in this day and age, a lot of nurses, doctors, pharmacists, and other providers are very reliant on technology. And there's some great innovations in the field coming about. A lot of applications for diabetics run on cell phones, for example. Helps the diabetic manage their diet, their insulin, their blood sugars, all through applications in a common cell phone, for example. So that's sort of what I do: quality, safety, equity of health care, and then informatics, how informatics supports across the system of care.
So you will be involved with prevention, and we're going to let you talk more specifically about all of those areas when we come back. This is a call to action.
Call to action.
Having a very, very interesting discussion as it relates to health and outreach and having a better community and diabetes and the system of care and how to, all these very, very interesting things. And the good thing about this conversation is that health affects all of us. You can't circumvent this. So the more information we have as it relates to that, then the better off we are as a community. And the thing that I like that you just mentioned, Dr. Gilbreath, is that, it's 3 phases, and one of the phases is prevention and education. So let's talk about that.
Yes,
for
yeah.
a while.
Well, as Julie mentioned, one of the biggest things that a diabetic patient could do is maintain their ideal body weight. But even prior to that, type 2 diabetes that you were talking about is a genetic form. It is inherited. So understanding your risk for developing diabetes as an adult later in life is important to know that you're at risk. You might even pay attention early in your life to the correct diet and food. Now, I think I adhere to this, and the National Institutes of Health recommends 800 grams of fruits and vegetables a day, and that's equivalent to 4 apples. Now that's a lot of apple, but for example, you could have bran and strawberries in the morning, you could have salad at lunch, you could have a good helping of vegetables at dinner, and you could top it off with an apple or an orange at bedtime. You've got your 800 grams of fruits and vegetables. That alone has been shown to reduce mortality, death rates in populations that have 800 grams of fat a day, and that would be a pretty good diabetic diet. The other thing for
800 grams of fruit.
Fruit and vegetables, yes, sir. The other thing is looking at complex carbohydrates. Instead of table sugar or sugar that ends up in pies and cakes and candy bars, move to complex carbohydrates. For example, fruits are a good source of complex carbohydrates, or even fiber. High fiber diets, wheat, and things of that nature, bran cereal, are very effective in the proper type of diet. And if that gets ingrained at an early age with children, instead of high sugar cereals as a child, give them some bran cereal or granola cereal with fruit, get them used to that. That can be very preventative later in life. And then, of course, paying attention to your weight and maintaining that ideal body weight and regular exercise are all ways that you can help prevent the development of diabetes if you're at high risk.
Oh, that's outstanding. Talk a little bit about, what's the name of the Health Ways?
It's Diabetes Health Ways.
Diabetes Health Ways. Talk a little bit about what you all do, their function and activities and programs.
Well, we see inpatients at the hospital as well as outpatients. We do both adult and children. And so we offer just education. We don't have any physicians in the office for outpatient, but we get referrals from any physician in the surrounding areas, and we just educate people on pre-diabetes and diabetes. So I think to get the education that you need to learn how to take care of the disease process helps prevent those long-term complications that Dr. Gilbreath was talking about earlier. With all of the technology and knowledge about diabetes these days, we can prevent those long-term complications. It goes back to the behavior change and the motivation to keep going to make those changes that we need to, and that's one of the hardest parts, because this is an everyday process that, they don't get a break from.
Does one need to be referred by a doctor in order to participate in Diabetes Health Ways?
Yes, we do for the education classes. We also offer support groups. We call the adult ones Lunch and Learns, that we just had one yesterday on diabetes and foot care. So we do those quarterly, and then we also do ongoing activities for the pediatric population. We do family fun days. We have a free diabetes camp that one of the physicians in town has been doing for years. So we try to do ongoing support that people don't need referrals to, but as far as the education, we do need a physician referral.
Okay, so if one is interested in maybe learning more or participating in some of these activities in which they are eligible, what process should they use?
They can call our office at the main number at the hospital. We also have it on our main Navicent website, any events or class schedules that we do, so they can use either avenue for that.
And then it's called Diabetes Health Ways.
Yes.
Both of you. I'm real concerned about childhood obesity. It's very, very different now than what it used to be. And could that contribute to diabetes?
Absolutely, and I think dietary habits start at a very, very young age with children. So let me just clarify, when I said 800 grams of fruits and vegetables, I didn't mean only 800 grams. You can still have fish, chicken. You can still have red meat in a moderate way. I'm the first to tell you I love barbecue and fried food, but that in moderation. But make sure you're getting 800 grams of fruits and vegetables a day, and then you can add on the others, okay? And move more towards white meats, chicken, fish, pork, away from red meats, which are high in cholesterol. That's the other issue with diabetes, is high-fat diets and animal fat, red meats in particular, can elevate cholesterol, and it's really a double whammy when you have sugar problems and you have fat problems, and they combine to create heart problems. So a diabetic diet, as you can see at an early age for a child, I mean, they love hamburgers and hot dogs. Move them away from processed
and French
food.
fries.
Give them baked potato, give them, instead of French fries, and give them fresh fish and chicken and pork, and as an alternative for a lot of highly processed foods like sausage, hot dogs, and hamburgers.
Wow.
And one of the biggest things I think too for children are the sweetened beverages. If we can get them away from the regular sodas, the sweet teas, and especially the Gatorades and Powerades, children or adults even just drink those as just general beverages. That's not what they were designed for, and they're packed full of sugar. So that's one goal. When we get people there, if they're only willing to make one change, we'll ask, could you stop all of the sweetened beverages first, and then let's work on moderation and portion sizes for your diet.
What about water? We're going to talk about the importance of water, because last time I was examined, my doctor told me you need to drink more water. So we're going to talk about, and that's easy to do. You can get water anywhere and it's free. Exactly. This is a call to action.
Call to action.
I'm your host. We're back, and we stopped. We broke while we were talking about the importance of just H2O, plain old water, and how much should one try to drink, and the significance of drinking water rather than those sugary drinks that you mentioned.
Water is extremely important, and it's free. So I think that's something a lot of us don't drink enough of. So at least around 8 glasses of water a day, if we can manage that, just keeps us hydrated, keeps us feeling better. So it's very important, and especially for people with diabetes, to make some substitutions from those sugary drinks. Water's doesn't always have a taste, but it is great for us. So if we can encourage them to drink more water, that's wonderful.
I have, I've had a drink of water, and I've said, man, this sure is good. So it can be very, very pleasing. And matter of fact, I guess I better go ahead and practice what you preach.
Refreshing.
Yes, it's very refreshing. As a matter of fact, now one thing that happens that I've tried to do is that I used to order tea, Diet Coke or soda with my meals, but now I've gotten in the habit of just ordering water. I always say water. And so that works pretty good too. So that's one way of drinking more water, is just to have it with your meals.
Right. A lot of times we don't drink enough, and so we will go and get some when we're thirsty, but we need to drink before we get to that point, because a lot of people stay more dehydrated than they really need to be.
Okay. Let's talk about categories of individuals and groups that tend to be more susceptible to diabetes, and let's talk about how you can look at certain groups and see that the incidences of diabetes are much more prevalent. You talked some about outcomes.
Yes, sir. Yeah. Well, Navicent has an active program in health equity, and we're focused on health outcomes disparities based on characteristics of a group, for example, race, ethnicity, language, where they live, their income, or education. So folks who may live in rural Georgia not necessarily because of a genetic or inherited condition, but they may not have access to physicians or healthcare providers. And that very isolation could lead to poor outcomes, meaning poor results. Uncontrolled diabetes, for example, heart attacks, strokes that result with untreated diabetes. So Navicent is addressing how we can influence that population and what they specifically need, okay, to improve those outcomes. The goal is resolution of health outcomes disparities. And like I say, it could apply to many different groups of people.
I understand.
We have an active program of how we address that. Typically, it involves interactions in the home, away from the four walls of the hospital. It involves altering, if you will, social determinants in the home. These are things like health literacy. Does the patient understand what they need to understand?
When you say offer them
diabetes?
in the home, how do they get it in the home?
Well, we have a population health or division, formerly known as population health. It's now called Healthy Communities, where we have case managers, social workers, palliative care counselors who are available to patients who have chronic conditions who need assistance in their home. It may be dietary assistance. It may be medication adherence. In other words, are they taking the right medicines and the right doses? It may be what we call health literacy, but that really is, do they understand what they need to understand about their condition to get better outcomes? Are they able to see a healthcare provider in the appropriate time frame? What is their contingency plan if their condition begins to spiral out of control? We want them to go into action earlier. For example. So those are some of the examples. Some folks have a lot of stress in their life. They may be depressed, and so those behavioral health issues are also integral to altering those social determinants that eventually get better outcomes. So we've had great success with chronic obstructive pulmonary disease, otherwise known as emphysema or smoker's lung, where our respiratory therapists under their director, Rodney Cooper, have developed a program where they intervene after discharge in the home, and those patients have very few admissions after that point and no readmissions, and they're able to maintain their health care much better at home. Also a similar program with heart failure or congestive heart failure. We had a similar program in the home that reduces heart failure readmissions as well.
Wow. Talk about disparity, and I'm sure that statistics will bear out the fact that African Americans probably proportionately suffer more from diabetes and other health factors more than other groups do. Talk a little bit about that. What can we as a community do? You know, not only, and I mean, I know that it applies to all groups, but disproportionately, you know, it seems that we have diabetes, heart failure, and other health problems. You know, what do you think could begin to address that?
Well, we risk stratify, meaning we assess a patient for the likelihood of downstream problems, okay, where they would get into trouble. So we try to identify those patients who really need help. And typically we understand it's going to be after they go home, okay? So then we have an analysis of what their issues are, and it's different for different people, okay? We actually apply these programs to all races, okay? But for example, in a given patient, there may be an understanding issue. They don't understand their condition and why they need to take the medicines, when, the dietary. So we educate them, health literacy. Secondly, we make sure their medications, they understand their medicines, how often they need to take them, they have access to their medicines, they can afford their medicines. Thirdly, we make sure they have access to follow-up health care, whether it's a nurse practitioner or their primary physician or specialist. We actually coordinate that for them. Fourthly, we do address the dietary issues. They're a little bit different based on the condition. But with diabetes, obviously, we've been talking about that for a while. So understanding those aspects of their condition is how we influence. And you can see it helps the patient and their family manage the condition once they go home. And that's very important. That alone has limited admissions and readmissions and the patient spiraling out of control with respiratory failure, heart attacks, etc. So we've shown some effectiveness in actually altering the outcomes by intervening in after discharge.
How does a person, now does one have to first be in the hospital and this is like aftercare, or is it accessible, even though you have not been admitted?
Well, we have to know about you. Okay, so there needs to be an interaction with the system in some way. It could be an ER visit. It could be a visit to one of the physicians who are part of Navicent Health, or it could be a referral. But you're right. We need to move upstream. We need to move before they're admitted, and that would be a very important program to implement as well.
Okay,
yes.
And I'm sure that you'll get to that sooner rather than later.
Yes.
This is a call to action.
A call to action.
I'm your host, Alex Habersham, having interviewed Dr. Reg Gilbreath and Ms. Julie Deese, who's in charge of Healthways for diabetes at Navicent Health. Dr. Gilbreath has done a phenomenal job with system care. What if a person wanted to get more information about all the programs? Is there a general number other than Miss Megan that they can call to see, just because it's so important? And one of the problems in our community is that people don't realize how many resources are available for any problem. So if one wanted to kind of get in touch with Navicent, what would be the process?
I think all of the different, communities, I'll say, in the hospital work well with each other. I think one of the population health has been great with getting people set up with whoever they need to be set up with. But I know we field a lot of calls from the diabetes office. If someone's interested in something else, we get them connected.
Okay.
There's a Healthy Communities division with Carol Babcock, and she and Carissa Wassel, a social worker in Palliative Care Council, actually had a lot to do with our heart failure improvement program, disparities resolution.
Okay.
They have a phone number, I don't know it off the top of my head, but they're called Healthy Communities at Navicent.
Healthy Community.
Yes.
And you can always go to the Navicent website, to get information about it. And NavicentHealth.org, I believe it is. So you can go to the website and then you can get phone numbers. And I do know that regularly there are programs monthly, every month throughout the community that deals with a lot of issues. And I think that the Public Relations Department of Navicent puts out a communique called Healthy Dates. And then I'm sure that you can call the hospital and subscribe to Navicent's magazine, which is called Elevate. Mm-hmm. So, well, I certainly want to thank you for coming on, and it's so important. And I just encourage everybody to be, including Alex C. Habersham, to be more conscientious about your health and realize that there are resources available that can assist us in living a healthy and a happy life. This is a call to action.
A call to action.
I'm your host, Alex Habersham. Have a great day.